So that is about 2 disorders which affect pure grey matter initially and then white matter. We'll now look at 4 disorders which are symmetric and involve grey and white matter equally to begin with. The commonly seen one of these is Canavan's disease. The child presents in the first year of life with large head and severe neuroregression with complete or near complete lack of myelination. Subcortical U fibers get affected first, and then the disease has centripetal extension towards basal ganglia. Hallmark of this disease, in addition to complete absence of myelination and large head, is very high Na. So here are 3 or 4 children from same family I am going to show. The eldest one, large head, virtually no myelination and degeneration of basal ganglia and thalami. Sibling showing very large Na peak, and because of scaling the other metabolites are looking smaller. Alexander's is again a disorder of infancy. They present in the first year of life with large head and neuroregression. This child was diagnosed as aqueductal stenosis in our ultrasound department because of ventriculomegaly. So immediately after birth, the child had of course large head and was shunted. This is the reservoir. In spite of shunting, child continued to have large head and neuroregression. So we did MRI. So in addition to residual hydrocephalus, what we are seeing here is affection of anterior white matter here. Large head, affection of anti-white matter and affection of anterior basal ganglia. So this pattern of grey and white matter affection is ventral to dorsal pattern. This is one more condition besides adrenoleukodystrophy where you get enhancement at the affected and unaffected white matter interface. And again, because this disease has ventral to dorsal pattern, caudate nuclei get affected earlier compared to globus pallidi. Here are 2 more patients with Alexander's, one showing lot of vacuolation in the periventricular white matter in addition to anterior affection of white matter. Here is another patient showing enhancement at the interface between affected and unaffected white matter. Next condition which affects grey and white matter almost equally is Mucopolysaccharidosis. You know there are 13 subtypes. Hurler is the one where CNS gets affected the most. Metabolically, there is deficiency of lysosomal enzymes which are involved in degradation of glycosaminoglycans. On imaging, hallmark of this disease is dilated perivascular spaces of Furcault-Robin. In addition, you'll have a lot of bony abnormalities on X-ray. Because the bones are soft, you get CV junction compression, so basilar impression or basilar invagination, which is one of the treatable cause to avoid morbidity. You'll get J-shaped sella, metopic ridging of sutures, thick enhancing meninges because of deposition of mucopolysaccharides in the meninges, and you'll get trident hand and what is called as canoe paddle ribs. So here is a patient with Hurler's, numerous dilated perivascular spaces of Furcault-Robin across brain. Here is an article published in 2012 which talks about, based on radiological findings, differentiating 3 subtypes of mucopolysaccharidosis from other 9 subtypes. So the first three, Hurler, Hunter, Sees and MPS 2 and 3 have more of CNS abnormalities like signal alteration in the brain parenchyma, prominent perivascular spaces, ventricular dilatation and atrophy, whereas the other subtypes 4 onwards would have more of soft bones and hence spinal canal stenosis. They have lesser of CNS affection. So just by doing spine X-ray and brain MRI, before you go on to expensive tests, you can try and divide this MPSs. Next condition which affects grey and white matter equally and symmetrically is Wilson's disease, which is now called as hepatolenticular degeneration. Clinically, the child would have KF ring, which at times can be extremely difficult to detect, cirrhosis. Because of degeneration of basal ganglia, they will have extrapyramidal syndromes. And what we look for is symmetric hyperintensities in the puttamina and globus pallidi, which is commonly seen, and then face of the giant panda sign in midbrain. So here is a classic example of Wilson's, where you have got striatal degeneration with restricted diffusion. If you only see this and if you have no clue, there are several other differential diagnoses of striatal necrosis like carbon monoxide poisoning, hypoxia, encephalitis, etc. Even extrapontine myelinolysis. Here is another patient showing basal ganglia and thalamic affection, which is symmetric with little bit of atrophy. Here is a borrowed example of face of the giant panda sign, which we look for in Wilson's. This happens because there is a lot of degeneration of midbrain with relative sparing of red nuclei which look like eye of the giant panda, superior colliculi which remain dark here, periaqueductal grey matter which remains spared, and pars compacta and reticulata remaining unaffected, which look like ears of the giant panda. This is seen in less than 20% cases, but if it is seen, it is diagnostic of Wilson's or hepatolenticular degeneration. And as I said, all these conditions so far that we looked were all symmetric. There are 4 or 5 conditions which are asymmetric, which will allow you to make diagnosis of these conditions relatively easier compared to the conditions we saw so far.